and welcome to Faith and Life Fellowship Ministries for another impactful Wednesday night. Tonight we are doing things a little bit different as we prepare for our community health fair, which will be this coming Saturday, June 19th. It is, yes, Juneteenth, and that is going to be here from 9 until 12. We do have a couple of things that are going to be available to you. There's going to be colon cancer screening, HIV testing, HPV testing, mental health consultations, and so much more. Tonight we have with us a great medical professionals who are going to be sharing some impactful things with the community. Today we are going to introduce them, and then they're going to share some of the things that have impacted our community within the last couple of months, especially during this time of the pandemic. So without further ado, I'm going to introduce our guest tonight. We do have with us Dr. Peter Kim. We also have with us Tamara Dixon. Also with us tonight, Nadine Gousse. We also have Joan Nicholson. And we have Garfield Young. So we are very excited for this great panel, and today they're going to share some information with you. We're going to get started with Dr. Kim. And Dr. Kim, thank you so much. We want to thank all of you for being a part of this panel tonight. And we thank you for coming to Faith and Life Fellowship Ministries and really to the Hollywood community. So at this time, we're going to hear from each one of you, starting with Dr. Kim, about your profession, what you're doing, and tell us a little bit about what you do on a day-to-day basis.
Thank you for having me. I am an ICU doctor, which is essentially what I do is I try to help take care of the sickest of the people in the hospital. Anybody who comes in with problems like heart attacks, strokes, and these days a lot of it is COVID, because anybody who has trouble breathing and might need advanced support, like a life support machine, will end up in the ICU. So I help the hospital take care of all those patients.
Thank you. All right, now we have Ms. Tamara Dixon.
My name is Tamara, and I currently work as a cardiac nurse practitioner, seeing patients with acute and chronic heart diseases such as heart failure, acute heart attacks, cardiomyopathy, etc. For the last few months, I was deployed to work with Dr. Kim in the COVID ICU as an intensivist nurse practitioner, helping assist with taking care of these critically ill patients. But now I'm back in cardiology, taking care of cardiac patients.
Thank you so much. All right, Ms. Gousse.
Thank you for inviting me. I'm Nadine Gousse. I'm a licensed mental health counselor. And sorry. I'm Nadine Gousse. I'm a licensed mental health counselor and school counselor at the same time. That's what I do on a daily basis. My work is to deal with individuals that have cognitive, behavioral, and emotional issues. On a daily basis, I deal with them to make sure their mental health, their mental well-being is approved over time.
Perfect. Thank you so much. All right, and now we have Joan Nicholson.
I'm Joan Nicholson, and I focus on hospice care. We, on hospice care, we take care of the people who are dying. Terminally ill patient with disease that's not reversible, it's not going to be better, they're going down. Okay, so the visit is, it depends on how the patient is. You do visit for twice per week, 3 times per week. It depends on the condition of the patients. We have on the team a physician, a nurse, a social worker, a chaplain, and some other nurses that if the patient is on continuous care, they fit in. So that's basically what hospice care does.
Great, thank you so much. And last but not least, we have Garfield Young.
Good afternoon. My name is Garfield Young. I currently work in the ICU setting. I work alongside Dr. Kim over the past 15 years, I would say, within the ICU. We take care of critically ill patients, patients that have life-threatening or immediate acute care needs, and we see a mixture between COVID and non-COVID. Over the past couple of months, we see a lot more COVID than the regular patients, but they're working on a day-to-day basis. It's more like clinical setting, helping the nurses to get through the day as well as the patients. Thank you.
So thank you so much for just sharing a little bit about what you do on a day-to-day basis. Tamara, we're going to start with Ms. Dixon. We're going to start with you first because you did mention that you worked with more heart patients prior to the pandemic, and after that you worked in the ICU taking care of more COVID patients. Tell us how this change has been for you during the pandemic. Did we have a lot of changes as far as your work and the things that you did before? And what are you seeing in the hospital?
Okay, so back in March of last year, 2020, as you know, everything got shut down, including the hospital with surgeries and things that were non-emergent. So with that time, I got deployed because I was in cardiology and that service was slow. So because of the ICU and emergency room that was very high volume with COVID patients, so we got deployed to work with Dr. Kim and Garfield in the ICU setting. It was a lot in the sense that I've worked with Garfield now for over 12, 13 years, and with Dr. Kim as well, and we were used to saving lives in the sense that's what we do. Maybe one patient per week before COVID died, and with COVID, they were dying 5 per day, 6 per day, and no matter what we were doing, it wasn't helping. So in that regards, it was very life-changing that whatever we were doing wasn't working. It was very depressing. I went home crying because people were just dying. So it did change my life in the way where I start taking care of myself, because what we saw with patients, that the majority of them were obese, the majority of them were hypertensive, the majority of them had diabetes, that were the underlying condition which increased the morbidity and the mortality. So with that being said, I promote lifestyle changes such as better eating, exercise regimen, because then the mortality will be decreased when you start taking care of yourself. So that kind of changed me, because after that, I start taking care of myself.
That's a really good information there, because that just shows us like some of the side effects or things that really kind of cause people to be in a little more acute state, right? Garfield, you mentioned about things changing at the hospital. I want to ask you, what was it like for the families? I know that families were able to come into the hospital, but how did families connect with patients or their loved ones when they weren't able to come into the hospital?
Very good question. I work for a major healthcare system within the South Florida region. We are built on patient family-centered care. That was our motto and still is. However, with COVID, it changed a lot because we weren't allowing families to come in because everybody was pretty much guarded about COVID. We didn't know exactly what it was, how to treat it. Otherwise, there was a new treatment plan, a new treatment regimen coming out on a monthly basis because everybody was up in topsy-turvy. It's a pandemic. And it's like fighting a battle that you can't see your enemy. We were all guarded, so in terms of visitors coming in, we kind of shut it down for a little bit because we also had to protect the nurses, because nurses ourselves were getting COVID. Nurses ourselves was dying from this disease that we couldn't have seen, couldn't catch, didn't really identify at an early stage. Also, what we did though, to provide family-centered care still, we used the WebEx system. We came up with iPads where we would call the family and have the family see their loved ones from the iPad, face to face, like a FaceTime. It still didn't I wouldn't say it had a big impact. It had an impact, but it didn't have a big impact like how patients would actually come in, family would come in to see the patients. So it was hard for the families, hard for the patients as well, because most of them were on ventilator. The last time they would have seen their loved one is when they walked through the emergency room. That being said, some patients were in the unit for months, 6 months, 5 months, 2 months, and not seeing their loved ones. So it was hard, not only on the patients, not only on the families, but also on the staff.
Yeah, and it sounds like that was what also Tamara is saying as well.
What I can add
Yes.
to what Garfield just said, the mental touch, it's very important because because sometimes you might visit a family member at the hospital, they could be in a coma, but by just touching them, although
Yeah.
they're in a coma, but they feel your presence and they feel your touch, and not being able, to touch to receive this touch, it's a big deal.
So, Ms. Gousse, tell us a little bit then about how the mental health of patients that you've been seeing or families that you've been seeing since the COVID or the pandemic has occurred.
First of all, since COVID has started, there's less physical contact. We have not been able to see the client physically or the families physically. We have to do all our sessions virtually. And virtually, sometimes it could be a challenge to establish a good rapport, with the client. It takes more work. It takes more work to establish this rapport. But over time, it's been working because it is what it is. We have to do it virtually. We cannot do it face to face. But they
Right.
start realizing, okay, I need the service, so I'm going to comply. I'm going to comply the fact that it is virtual. I will have to comply in order to get better.
One of the things that's really good and that we have coming up with this health fair, it's a perfect timing. We didn't really plan it for keeping in mind that the vaccination and all these things would be out. But what is really good about that as it relates to just people being isolated is that you can go back to the doctors, you can go back to hospitals for a certain amount of time, and you were able to connect with people again. I did remember that during at some point in time, you would have your doctor visit on the phone, or you had to do it by Zoom or another means. And so at least now is an opportunity that people are being able to go back into the hospitals or becoming face to face with each other. Right now I was listening to the CDC guidelines, Center for Disease Control and Prevention, and as I was looking at it, it said that 64.5% of adults have at least one vaccination at this time, which has allowed for us to be able to open up a little bit more freely. Now, that doesn't mean that everybody has been fully vaccinated, but it has allowed for us to be able to have a sense of normalcy. So, Dr. Kim, I want to ask you these questions and just kind of give me your take on what are some of the side effects that are there with the vaccine, and what is your take on the vaccine?
I think my take on the vaccine is that I think the science shows that the vaccines are quite effective in terms of trying to prevent somebody from developing very severe cases of COVID that would lead to them to come to the ICU. I can tell you personally, and I think Garfield would agree, that we haven't really seen vaccinated patients end up in the ICU, which is a relief, because it was endless for a certain time of seeing people who had formerly been fairly healthy coming to the ICU, which is unusual for us. So I do think that it is effective in terms of trying to prevent somebody getting ill. That being said, there are side effects. I think most people will develop pretty significant fever and flu-like symptoms with one or two of the vaccines, so there's a caveat with that. And the reality is, I believe it's still under emergency authorization, which still means that it's a new therapy, and To be honest, we don't know 100% because it has not gone through the normal type of approval process that we do for all the medications and vaccines that we usually use. But just being on the front lines of seeing how sick people get, in my opinion, I think the benefits of getting vaccinated do outweigh the risks of the vaccine.
So what would you say to those who may be skeptical about using the vaccine or taking the vaccine? A lot of people have been very skeptical that they're injecting themselves with COVID, or there's not enough research for them to be able to take it. And I know that when Johnson & Johnson, not promoting any particular vaccination, but when they pulled it, or they pulled some other vaccinations as well in different countries, people were very nervous and probably very skeptical about vaccinations. So what would you say to those who are skeptical about taking the vaccination?
Well, I respect anybody's skepticism. I mean, I think that is normal and it's healthy. I had skepticism too, because of how fast things were approved. I think one has to do their own individual research to convince himself about the safety of vaccines. I think that people have to be cautious about where they source information, which is easier said than done these days, I think. You know, it's very difficult to sort through information these days. Especially I think if you're not a healthcare professional or a scientist, it can be difficult to sort through that information. So I think consulting with professionals that you trust would be a good way to try to sort out whether a vaccine is correct for yourself.
Great. So let's talk a little bit, Ms. Nicholson, about hospice care. Now, we've had millions of people die, not just here in America, but all across the world. And the number of deaths have been enormous. And you know, there's a whole process with the grieving, and we're going to talk to Ms. Gousse about that. But just share a little bit, Ms. Nicholson, about that hospice care for families, not just dealing with COVID, but as Ms. Dixon mentioned in a couple of the other things that people are dying of. There are other things, other statistics out there. In fact, they said in 2018, just before this pandemic occurred, right? In 2018, part of the top 10 things that were top 10 deaths that occurred, apart from accidents and so forth, was actually heart disease, but also suicide. Suicide made it up in that top 10 area. So talk a little bit about families and what families can do if they are in the process or now having to go into hospice care. Of course, no one likes to hear that their family member is now needing hospice care. And I know that the nurses and the doctors on our panel, as they mentioned, do everything to try to make sure that their patients survive. But as Ms. Dixon said, there were sometimes 5, 6 patients dying a day. Tell us a little bit about now the hospice side of it.
The hospice side of the pandemic, well, we don't have like a large bulk of people just dying, like in the COVID, you know, people just dying, a lot of people. But gradually, as your diagnosis is, people will die from time to time. So there's not a really bunch of people dying at the same time. Gradually, as the disease progresses, then they die.
So then how do you work with families during that time, and what is the kind of care that you give to the patient and the families?
Well, we continue as hospice does. The visits, the personal care, we might increase on the visits as you go, and the medication and everything, and you calm them down, because some of them are aware of what's going on, and they might get a little afraid or what, but you have to encourage them, and you have to give them all the support they need. And also the family. Because think of a family having a patient that is dying, and then here comes COVID. That is like double problems because they're wandering. So what the nurses have to do, we usually use our PPE even before COVID. We even use our skill as is even before COVID, because a patient is a patient despite what's going on with them. So we always use our PPE, we always take care of them as usual, and we move forward. Just encourage them, and for the staff, we teach them not to stop doing what they're doing, but do extra. If you're not going to use your mask, use your mask. If you're not going to use your gloves, use your gloves, because everybody knows that those are the CDC guidelines, and we should adhere to that.
Good, thank you so much. And Ms. Gousse, I would like you to share a little bit about then how your end on how you deal with the families as they're going through so much grief and so forth.
Lately, things have been different due to COVID. What I've been doing, there are outside agencies that I will refer the families so they could get extra help. The one that are religious, I will refer them to a pastor where they could get more support. And grievance is totally being done differently right now as a result of COVID, because it's more effective when you meet face to face with the family. So now it had created more stress, more anxiety, and to the families, and sometimes they don't even want to talk to you.
Is that because of the isolation or them being, you know, not being able to connect with people?
Yes, especially, I'm going to give you an example. There is a husband, he's been married for 50 years, and the wife was diabetes. While at the hospital, she contacted COVID, and he was not able to see her until she passed on. And she didn't want to do any grieving counseling, and I do understand that. You've been with somebody, your mate for 50 years, not 50 days, and you never had a chance to say a proper goodbye, to hug that person, to be with that person in the last moment, and to do counseling, to do grieving counseling over, virtually, it's hard. It's not the same, because you have to be there in person. You have to be able to hold that person's hands, to, as I said, the human touch, it's everything.
So what do we do with all the, there's so much grieving going on even right now. You think about all those people who have loved ones that have passed on and that they weren't able to, grieve in the same manner. What kind of advice would you give, and this is to anyone on the panel, what kind of advice would you then give to that family? Because people are still grieving, a lot of people are grieving. So how can they get help? What kind of services are there available for them?
There are a lot of services that are available out there, but unfortunately, I did not bring any information, but during the fair this weekend, I'll be able to bring some valuable information where they can get some face-to-face services.
Okay, so, yeah.
Also, I promote therapy in the sense that talking to someone, because when you lose someone, as you said, what you said about the 50-year-old, the person who's been married for 50 years and wasn't able to say goodbye to their wife, we lived that. That was like an everyday thing for us. And for therapy for the family members as well as for us as healthcare providers, because it wasn't normal for you to have a family member die and not being there to hold their hands and having them take their last breath. It's many times Garfield or I have to be in a room with the WebEx with the family member for them to say goodbye to their family while they take their last breath on FaceTime. But I do promote therapy in the sense of speaking to a therapist once a week, once every 2 weeks to kind of get that out, because if you keep it inside, it will eat you alive.
Now, do you think nurses need that as well too? The same, and doctors, do they need the same level of therapy as well and so forth as
Yes.
as the
Yes,
families?
100%, because I'm a believer in God and I turn to God for everything, which I still do, but having a person to talk to and giving dialogue of how to go over certain situations, I promote that 100%.
Yeah.
I agree with the panel. I believe that grieving during this normalcy of COVID, because COVID has changed the game. I don't think we'll ever be normal again, whatever normal was for us before. I think there's a lot of opportunities for counseling as well as support groups. I know there's different avenues Ms. Gousse probably will be able to address this weekend. There are a lot of support groups that are available for people who have lost loved ones, families that have lost loved ones come together to share their thoughts and feelings. For us as healthcare workers, we ourselves, I think most hospitals, I would say healthcare systems, have allowed their chaplain to come in and meet with the staff ourselves in terms of grieving, because we all grieve, whether or not we have a loved one who have died, or caring for a loved one, or caring for a patient who died. We all are connected somewhere or another with someone who has COVID, who have died, especially in the unit. So having that togetherness from the staff, one of the things that I implemented at my hospital is that every morning we'll have devotion, we'll pray before we even enter the rooms, because that wasn't normal before. We weren't able to mix the church and state before. But having seen COVID live in the ICU is something that I started, and we did it up to now. We try to do it every morning before each member goes inside the room. We pray and we connect before and ask for covering before we go in, because we're fighting a disease that we still don't identify what it is.
You know, I'm glad that you mentioned that, because at Faith and Life Fellowship Ministries, this is the one of the things that we are doing here with the health fair, is that we're also offering our a community the opportunity to come in and, one, get that mental health counseling, but also, as Tamara may have mentioned, you may want to meet with a pastor, and they're going to be here and available on Saturday to pray with people and to pray with families. Sometimes people feel more comfortable sharing with a Christian counselor, and they're going to be also on site as well. As Ms. Gousse said, there's also going to be available agencies and places that families can go to who may not be Christians, and they may want to, or even if they are, you still may need someone to speak to or have ongoing therapy. So those are some of the things that are definitely going to be available this Saturday, June 19th, from 9 to 12, and it's only for about a few hours, so definitely you want to be here, be on time to really get that information. Dr. Kim, I do want to ask you, I know that there are other things going on in the hospital other than COVID, and now we're seeing some turns in the tide where we're doing a little different from just only COVID, and we're back to some of the other issues and concerns that are there in healthcare. What advice would you give generally to patients? I know Tamara touched on a little bit of the things, just looking, caring for your body, your health, your mental state. I know that, like we talked about before, heart disease and diabetes and some of these different issues that people do have that send people into the ICU, and sometimes prevention is better than cure, and sometimes we wait until it's an issue where we have to cure it. But what are some of the things that we can do as a community to really start paying attention to our health?
COVID, I think, is, if not the greatest, one of the greatest challenges that have been presented to our society. It's like, it's like this widespread challenge, and the only way to meet like a societal challenge like that is to rally as a community. I commend what you're doing through the church. I think it's fantastic, because the only way that we'd be able to deal with something that's going to affect everybody is to act as a community. So everything like from masking and trying to protect others, considering vaccination, helping people through the grieving process of people who've lost their loved ones. All of this requires us to act as a community to care for each other, you know, and I think that's really the only way that we're going to be able to make it through this. And I'm getting the impression that it's already happening, that we are seeing less patients come in sick, but it's not over, so we just can't let up just yet, and still try to protect those who are still vulnerable. I think that's the main key towards trying to stay healthy. Of course, there's always other things like heart disease, diabetes, so you do have to take care of yourself. I mean, Tamara's right, though. I mean, like, when most people come in there sick, like, they probably were not taking the best care of themselves. I mean, let's be real. But you know, there's a lot of temptations out there. It's hard to live that perfect lifestyle, you know, and I think you can, I mean, I don't know if what you think, but I mean, a lot of the people that we saw who got really sick, I mean, you wouldn't expect somebody like that should get that sick from something like a virus, you know, so it's, you can only do so much, I think, to try to prevent risk factors. I think really it's, the keys are, you know, still wearing the mask if you're not vaccinated, really considering getting vaccination. I think that's the key, try to prevent getting very sick from COVID.
Thank you so much. Tamara?
As you said, there's COVID and there's non-COVID. So now I'm back in cardiology. I could tell about the non-COVID. So it's all this about prevention is better than cure. Going back to the basic prior to COVID, meaning getting your blood pressure screen, your diabetes screen. I remember we did health fairs here where you just did the basic. So getting back to that, diet.
Seeing your doctor on a regular basis, yes?
Yes, see, exactly. I think especially in our community, African American, we lack to going to the doctor. So getting back to diet, exercising, low salt diet, cardiac diet, so forth. So back to basics prior to COVID, and after COVID, still doing the basics.
Okay. Is there anyone else who would like to just share out anything that has been life-changing since COVID? And I know Tamara mentioned some of the things that she changed. Anything else that is life-changing that you want to share as we get ready to close out?
I think just like what Tamara says, changing your eating habits, seeing your doctors on the regular, you know, follow up not just with the internal medicine, but see a cardiology. Diet, Dr. Kim and Tamara will tell you, we have seen a lot of patients in the unit, and the ages were like between 40 and 70s. Everybody was dying. Just remember, having the vaccine is not a cure. Having a vaccine is not a cure, but I believe that it helps in terms of the severeness of the disease. The severeness of the disease. If you have it, it doesn't make you that sick like how it was before. That's my thoughts. I don't know. I mean, if anybody's want to chip in on that part, but just doing the right thing by yourself.
Yeah, I agree in regards to that. And I too was skeptical about the vaccine, and when I looked at the pros and cons, COVID is not if you're going to get it, it's when you're going to get it. And to decrease the severity of the disease, that's all we want, to kind of take a little pressure off the yeah, exactly. So that's my thought.
Thank you. Ms. Gousse?
My final thoughts will be for everyone, due to the isolation of COVID, to establish a strong system support and check on your loved ones, friends and family, especially if you haven't heard from them for a while. Pick up your phone and give them a call. Sometimes a phone call, it's like $1 million.
It sure is.
Yes.
All right. Well, I just want to thank all of you for, yes.
I just want to add one thing that if somebody does get sick from COVID, I would encourage somebody to go seek a doctor and get yourself evaluated quicker because therapies work better earlier in the disease. If you wait too long, it can be very difficult to get things turned around. So, don't be afraid of going to see like a healthcare professional if you have symptoms of COVID, because the earlier you get treatment, usually the better you'll do.
Thank you, and that's a really good note to end on. I just want to thank all of you for being here this afternoon and just sharing this information, valuable information with our Hollywood community and our community at large, our global community. And we want to thank you again for joining us this evening here at Faith and Life Fellowship Ministries. Remember that we do have our health fair this coming Saturday, June 19th. And that is going to be here at the site. It is going to be from 9 until 12. I also want to mention that we have with us the youth are here all week long, and they have been here already for a couple of days now, but you can still get in on the Vacation Bible School that is available here at the church. Again, we want to thank all of our panelists. Again, this is Dr. Peter Kim. We have Tamara Dixon, we have Miss Nadine Gousse, we have Miss Joan Nicholson, and we have Garfield Young, and we want to just tell them thank you for joining us this evening, and we look forward for all of you being a part of that health fair this coming Saturday. Thank you and have a great evening.